nutrition is a global health crisis, claiming millions of lives each year. The World Health Organization estimates that unhealthy diets are responsible for 11 million preventable deaths annually. This staggering number surpasses the death toll from smoking and highlights the urgent need for dietary change. By making conscious food choices, we can significantly reduce our risk of these chronic diseases and live longer, healthier lives. Diets lacking in essential fruits, vegetables, legumes, and whole grains deprive our bodies of vital nutrients, compromising our immune systems and overall health. Let's work together to make nutritious food accessible to all and empower individuals to make life-saving dietary changes. When it comes to unhealthy diets, certain foods stand out as major contributors to chronic disease. Sugary drinks, including soda, fruit juices, and sports drinks, are a leading source of added sugar in the modern diet. Excessive sugar intake is linked to weight gain, type 2 diabetes, heart disease, and other health problems. Processed meats, such as bacon, sausage, and deli meats, are classified as Group 1 carcinogens by the World Health Organization. Refined grains like white bread, white rice, and pastries have been stripped of their fiber and nutrients during processing. Unhealthy fats, found in fried foods, processed snacks, and many baked goods, contribute to weight gain, heart disease, and other health problems. By limiting these dietary culprits and embracing whole plant-based foods, we can take a significant step towards improving our health and well-being. The link between diet and disease is undeniable, supported by a vast body of scientific evidence. A landmark study published in The Lancet found that unhealthy diets are responsible for 1 in 5 deaths globally. Research has also revealed the mechanisms by which certain foods contribute to disease. For example, excessive sugar intake leads to insulin resistance, a key driver of type 2 diabetes. The Mediterranean diet, rich in fruits, vegetables, whole grains, and olive oil, has been consistently linked to a lower risk of heart disease, stroke, type 2 diabetes, and certain cancers. By embracing a balanced, nutrient-rich diet, we can significantly reduce our risk of chronic disease and live longer, healthier lives. Unhealthy eating habits can set off a cascade of negative consequences for our health, increasing the risk of a wide range of chronic diseases. One of the most well-known consequences of poor nutrition is obesity. Consuming a diet high in calories, unhealthy fats, and added sugars, while lacking in fruits, vegetables, and whole grains, can lead to weight gain and obesity. Heart disease, the leading cause of death worldwide, is strongly linked to unhealthy dietary habits. Type 2 diabetes, a chronic condition that affects how the body regulates blood sugar, is also closely tied to diet. Certain cancers, including colorectal, breast, and prostate cancer, have also been linked to unhealthy diets. By understanding the health risks associated with unhealthy eating, we can make informed choices to protect our health and well-being. Section 5. Eating for life. Practical tips for a healthier plate. Transitioning to a healthier diet doesn't have to be overwhelming. Start by filling half your plate with fruits and vegetables at every meal. Choose whole grains over refined grains. Opt for whole grain bread, brown rice, quinoa, and oats instead of white bread, white rice, and processed cereals. Limit processed foods, sugary drinks, and unhealthy fats. Choose lean protein sources such as beans, lentils, tofu, fish, and poultry. Limit your intake of red meat and processed meats, which have been linked to an increased risk of certain cancers. Cook more meals at home where you have more control over the ingredients. Experiment with new recipes and flavors to make healthy eating enjoyable and sustainable. Remember, every small change you make to your diet can have a big impact on your health in the long run. Section 6. Knowledge is power, raising awareness for better choices. Public awareness is paramount in the fight against poor nutrition. Nutrition education should start at a young age, teaching children about the importance of a balanced diet and the impact of food choices on their health. Schools can play a vital role by incorporating nutrition education into their curricula and providing healthy meal options. Community-based programs can also play a crucial role in raising awareness about healthy eating. Public health campaigns can leverage various media platforms to disseminate evidence-based information about nutrition. Raising public awareness about the importance of nutrition is an ongoing effort that requires collaboration among various stakeholders. including educators, healthcare providers, policymakers, and community organizations. Section 7. Changing the food landscape, the need for policy action. While individual choices are important, creating a food environment that supports healthy eating requires policy action. Governments and policymakers have a crucial role to play in shaping a healthier food system for all. One effective policy intervention is the implementation of taxes on sugary drinks. Studies have shown that sugar-sweetened beverage taxes can effectively reduce consumption of these unhealthy drinks and generate revenue for public health programs. Another important policy measure is the regulation of food marketing, particularly to children. Food labeling regulations can also empower consumers to make healthier choices. By implementing these and other evidence-based policies, policymakers can create a food environment that supports healthy eating and promotes the well-being of all citizens. Section 8. A call to action: your health, your choice, your voice. The statistics surrounding diet-related deaths are alarming, but they also highlight the immense power we have as individuals and as a society to make a difference. Take charge of your health by making gradual but impactful changes to your diet. Start by incorporating more fruits, vegetables, and whole grains into your meals. Choose water over sugary drinks and opt for healthier cooking methods like baking, grilling, or steaming instead of frying. Seek support from family, friends, or healthcare professionals. Join online communities or cooking classes to share tips and recipes. But our responsibility doesn't end with our own plates. Support policies that promote healthy eating, such as sugar-sweetened beverage taxes and restrictions on marketing unhealthy foods to children. Section 9. Building a healthier future, one bite at a time. The journey towards a healthier future begins with a single step: a conscious decision to prioritize our nutrition and advocate for a food system that supports the well-being of all. It's about making small, sustainable changes to our diets, one bite at a time. Imagine a world where access to nutritious, affordable food is a right, not a privilege. By embracing the power of food as medicine, we can transform our health, our communities, and our world.